All right. I see that you're getting vancomycin, and you're going to be getting it, according to your doctor, you're going to get that for 6 more days, and that can cause some serious irritation to the inner lining of a vein placed in your lower arm like you've got down there. So they've asked me to place what's called a PICC line. It's a central line that's placed a little higher on your arm, up in the inner part of your upper arm up here. I use an ultrasound machine to look at these veins up here. Once I find a good vessel to use, I'll numb your arm up with something called lidocaine, place the IV at that region, insert the IV. We'll advance it up this vein in your arm until the very tip of the catheter reaches a large vein called the vena cava.
Where the heart is.
Beg your pardon?
The heart.
The heart. Up above the heart. Up above the heart. Doesn't go in the heart. If it goes in the heart, I've gone too far. Okay?
Yeah.
Takes about 30 minutes to do. We do it right here in your room. Let's see what your heart rate is like here. Oh, you're not on the monitor.
I'm not on the monitor.
And besides, look back, you were in a sinus rhythm, so we shouldn't have to get a chest x-ray, but if there's any question about where the tip of the catheter is positioned, I'll order a chest x-ray. We'll do that portable up here in the room. We just need to verify that the tip of the catheter is located correctly before these guys start using it. But my equipment, part of what I'm using is your cardiac waveform. I'll put a couple of EKG leads on you, and we use that to determine where the tip of the catheter is based on your cardiac waveform. But if I don't get, like I said, if I don't get the information I need, I'll order a chest x-ray.
And I'm getting two antibiotics, right?
You're getting Zosyn and vancomycin, I believe is what I saw on the profile.
That's right.
The vancomycin is the big one that you should really have this type of IV for. It's got a very low pH, and if you give it over and over and over again through a smaller vein, it really can start to cause a lot of irritation to the inner lining of that smaller vein. But if you have a central line in, like a PICC line, have the tip of the catheter located up here, you got enough blood flow in that region so that as soon as this medication hits your bloodstream,
So
it's immediately diluted.
It's going to go through my arm. The catheter is
inserted here, travels up the vein in your arm, across the shoulder, tip will drop down into the vena cava, provided your veins cooperate with us. The catheter placement takes about 5 minutes. I'm usually in the room about 30 minutes start to finish.
Not side effects, but
Risks.
yeah, with that.
That's the next thing I was getting ready to go over.
Yeah, I'm waiting on
Risks. Bleeding is one. We check your lab work, make sure your bleeding time is okay. I've looked at that. Yours is fine. Use ultrasound also to minimize that risk. Infection is the other risk with the insertion of the IV. So we do it under sterile conditions. We drape the bed out like they would in an operating room. I gown up, mask up just like I would be if I were going into an operating room. You wear a mask. In case
So
you
if I'm
cough or
already
sneeze.
dealing with an infection, a serious infection down here in my legs,
That's one of the main reasons we do PICC lines,
then
is for long-term antibiotic treatment.
okay.
Yeah. This is a very routine, not routine.
Serious danger.
It's an invasive procedure. There's always risks. Like I said, bleeding and infection are your primary risks involved with the placement of the catheter. Now, you're going to have this catheter, according to your doctor, for 6 more days at least. At least.
So I guess my question is, if I have loved ones, I need to.
Do the risks outweigh the benefits?
Do I need
or the benefits
do I
outweigh-
need to like call my loved ones and tell them, "No, okay, this is about to happen, just in case."
It's.
something
I
happens?
mean, my team, we travel the entire hospital doing this IV insertion. I wouldn't minimize it by saying it's routine. You don't have anything to worry about. But this is all I do.
Okay.
So, it's. If I run into any resistance as I'm feeding the catheter through the vessel, I back out, call the doctor, let them know that I've met some resistance. Like I say, your veins have got to cooperate. That's rare. But it does happen.
When will this be done?
We can do it right now.
Okay.
It's up to you.
All right.
Another nice thing about this type of IV is you don't have to get stuck for lab work anymore because they can draw it directly off this IV.
Okay. And this would just be used just for that. All right.
And when you're done with it, when you're done with these antibiotics, you take the dressing down, and it comes out like a regular IV. You don't have to have another procedure just to have it removed. In other words,
taken right on out.
Mm-hmm. These guys will do it.
Okay.
They do it up here.
All right. Okay.
You cool with it?
Yeah.
All right. Let me get the consent form, get you to sign that, give you permission to do it, and we'll